Ready to go deep on heart health? Great. Today, we'll be exploring WebMD's Understanding Heart Disease.
There's a lot to unpack there.
Right. But we'll break it all down. We'll cover the types of heart disease, how it's diagnosed, symptoms, and treatment options.
Understanding how this impacts your life, that's key.
Absolutely. And you might be surprised by some of this. Did you know you can have a silent heart attack? No symptoms?
Yeah, it's important to know the signs and risks.
We'll get to that. But first, how do doctors even know if you have heart disease?
It's a process, like detective work, really.
Okay, interesting.
The first step is you and your doctor talking. They'll ask about your symptoms, your past medical history, and any family history of heart issues.
That makes sense.
Then they'll do a physical exam.
So, listening to your heart with the stethoscope.
Exactly. To hear how it's beating, check for anything unusual. A heart murmur, for instance.
So those murmurs can be a sign of problems.
Sometimes, yes, they can indicate underlying issues.
So it's not all fancy tests right away.
Nope, not at all. Though tests are definitely important too.
Right.
One of the first they might do is an EKG.
An EKG.
An electrocardiogram.
Oh, right.
It's a simple test, records your heart's electrical activity. Painless.
Yeah, I've heard of those.
Yeah,
Those are the ones that show the spiky lines, right? Like you see in the medical shows.
that's the one. But there are a bunch of other tests too.
Like what?
A cardiac catheterization, for example.
What's that?
They thread a thin tube into your heart to get images and measurements.
Sounds a little intense.
It is a specialized procedure, for sure.
What else?
There's also imaging scans, like X-rays, CT scans, MRIs, and nuclear scans.
Okay, right. They give you a picture of what's going on inside.
Exactly. They help doctors see the structure of your heart and how well it's working.
The WebMD article mentioned angiography and echocardiograms too. What are those exactly?
Good question. Angiography is a kind of X-ray, but they use dye so they can see the blood vessels really clearly.
Ah, so they can see if there are any blockages?
Yes, precisely. They can see exactly where the problem areas are.
Like highlighting the trouble spots on a map.
A roadmap of your arteries, you could say.
I like that. And what about echocardiograms?
Think of it like a sonogram, but for your heart. It uses sound waves to create moving images of your heart.
Wow, so you can actually see the heart beating.
Yeah, it's pretty amazing. You see the chambers, the valves, all working. It can even measure how fast the blood is flowing.
So not just a snapshot, but the whole movie.
Exactly. It helps diagnose all sorts of heart conditions.
That's incredible. They mentioned a couple of other tests too, the coronary artery calcium score and a myocardial biopsy.
Right. The calcium score measures how much calcium is in your coronary arteries. A high score could mean there's plaque buildup.
And what's a myocardial biopsy?
That one is less common. It involves taking a tiny sample of heart tissue and looking at it under a microscope.
Wow, they can see that much detail.
It's incredible, isn't it?
It is. It seems like they have a test for everything. But let's be honest, most people are less worried about the tests themselves and more about what it means if they're diagnosed with heart disease.
That's a good point. The term heart disease is actually pretty broad.
Oh, how so?
It covers a whole bunch of different conditions that affect the heart. It's not one specific disease, but a whole category of them.
Like saying you have a respiratory illness.
Yeah,
It could be a cold or something more serious.
precisely. Each type of heart disease has its own set of symptoms, causes, and treatments.
So you really need to know the specifics.
Absolutely. Let's start with one we hear a lot about, coronary artery disease. Or CAD, for short.
Okay, CAD. Isn't that the one that causes heart attacks?
It can, but it's a little more complicated than that. Did you know that almost half of all Americans have some form of cardiovascular disease?
Really? That many?
It's the most common type, affecting millions of people.
Wow. So what exactly is it?
It happens when the arteries that supply blood to your heart get narrowed or blocked. Plaque builds up inside them.
Plaque buildup. That's what we hear about with high cholesterol, right?
Right, and that blockage can cause chest pain.
Ah, so that's the classic chest pain we associate with heart problems.
It's called angina. It can feel like pressure, tightness, squeezing, or even burning in your chest.
Not always that dramatic clutching the chest Hollywood heart attack scene though, right?
Not necessarily, and this is really important. Angina doesn't feel the same for everyone.
So it can be mistaken for something else.
It can. Sometimes it feels like indigestion or heartburn, especially after a meal.
That's tricky.
And this is especially important for women to know,
Why is that?
because they often experience atypical symptoms. Things like back pain, jaw pain, or just feeling really tired or short of breath.
So not always the classic elephant sitting on my chest feeling.
Right, you might not even realize it's your heart. So pay attention to any unusual discomfort in your chest, back, jaw, even your arms.
Good advice. Besides angina, any other red flags for CAD?
Well, along with chest pain, you might be short of breath, especially when you're active. Or get palpitations.
Palpitations.
Yeah, that fluttering or irregular heartbeat feeling. You might also feel dizzy, nauseous, sweaty, or even have pain that goes down your arm.
Not good. But those symptoms aren't always super severe, are they?
Sometimes they're mild and don't last long, just a few minutes, and they go away when you rest. But even if it's quick, it's still a sign that something's wrong.
So definitely talk to a doctor.
Absolutely. Always better to be safe than sorry.
What happens if you suspect CAD? What are the treatments?
The good news is that CAD can often be managed really well, especially if you catch it early.
That's good to hear.
Treatment usually involves lifestyle changes and medication.
Like diet and exercise.
You got it. Those are super important. Quitting smoking, eating a heart-healthy diet, regular exercise, those can make a big difference.
Seems like that's the advice for a lot of health issues.
It's true. Those healthy habits are key, but medications are often needed too. Your doctor might recommend a daily aspirin to help prevent blood clots, or medications to lower your blood pressure and cholesterol.
I've heard of those, like ACE inhibitors, beta blockers, statins, those sorts of things.
Exactly. And for angina, they might prescribe nitroglycerin.
What does that do?
It helps to relax the blood vessels so blood can flow more easily to the heart muscle.
So a multi-pronged approach to keep those arteries clear.
Exactly. Keep that blood flowing smoothly.
What if medication and lifestyle changes aren't enough?
In some cases, they might suggest a procedure like angioplasty.
Angioplasty.
It's where they insert a tiny balloon into the artery to open up a blockage.
Oh, interesting.
And a lot of times they'll put in a stent,
A stent.
a small mesh tube. It helps to keep the artery open.
So that's what a stent is. I've heard the term, but I wasn't really sure.
They're pretty amazing. They can really help people with blocked arteries.
And in the most serious cases.
Sometimes open heart surgery is needed to bypass the blockages.
Wow. So the treatment really depends on how severe the CAD is.
Yes, it does, which is why early detection and prevention are so important.
Absolutely. But let's talk about the scarier side of CAD. Heart attacks. I think most people know that CAD can lead to a heart attack, but what actually happens during one? What do people need to know?
A heart attack, or myocardial infarction, that's the medical term.
Myocardial infarction, got it.
It happens when the blood flow to part of your heart muscle gets completely blocked.
Blocked by what?
Usually a blood clot.
And what does that do?
Well, that part of the heart muscle is starved of oxygen. If you don't treat it quickly, it can cause permanent damage.
So it's a real race against time.
Every second counts.
Yeah.
You need to restore blood flow as fast as possible to minimize the damage.
That's why it's such a medical emergency.
Exactly. So knowing the symptoms is critical.
So what should we be looking out for?
The most common symptom is chest pain. You might feel a crushing pressure, tightness, or squeezing sensation in your chest.
So kind of like angina.
It can feel similar, but the pain is usually more intense and lasts longer with a heart attack.
And it can spread to other areas, right?
Yes. The pain can radiate to your back, jaw, neck, or arm.
And other symptoms.
Shortness of breath, sweating, nausea, vomiting, dizziness. Some people feel a sense of impending doom. You might also notice your heart beating really fast or irregularly.
Okay, so if we experience those, we need to get help immediately.
Immediately. Call 911. Don't wait to see if it gets better. Don't try to drive yourself to the hospital.
Time is of the essence.
It really is. Better to be safe than sorry.
But you mentioned silent heart attacks earlier, the ones with no symptoms. How is that even possible?
It can happen to anyone, but it's more common with diabetes.
Why diabetes?
Sometimes diabetes can cause nerve damage. You might not feel the pain of a heart attack.
So you could be having a heart attack and not even know it.
It's scary, but it's true. It's why regular checkups and managing conditions like diabetes are so important.
That's a great point. So if you think you or someone you're with is having a heart attack, what's the most important thing to do?
Call 911 right away.
Don't hesitate. Every minute matters.
You're absolutely right.
And we're back for more of our deep dive into heart health. We've already covered a lot of ground, from how doctors diagnose heart disease to the ins and outs of CAD and heart attacks.
And there's still so much more to explore.
That's right. Heart disease is a pretty complex topic.
Like a giant puzzle with all these different pieces.
Well, let's talk about one of those pieces. Heart failure. The name itself sounds pretty scary. Does it mean your heart just stops working?
Well, not exactly.
Cool.
The term heart failure can be a bit misleading. Your heart doesn't just shut down completely.
Okay, so what does it mean?
It means your heart's having trouble keeping up. It's not pumping blood as well as it should. It's like it's getting tired.
Like it's wearing out.
In a way, yeah. And this can happen for a few different reasons.
Like what?
Sometimes it's damage from a previous heart attack, or maybe high blood pressure has put a strain on the heart over time.
So it's been overworked for too long?
Exactly. And problems with the heart valves can also lead to heart failure. We'll talk about those a bit later.
Okay, so if the heart's not pumping blood effectively, what does that feel like?
It can vary from person to person, but one of the most common symptoms is shortness of breath.
Shortness of breath.
Yeah, especially when you're active or lying down.
Why does that happen?
When the heart's not pumping efficiently, fluid can build up in the lungs. Makes it harder to breathe.
Ah, so it's like your lungs are getting waterlogged.
Exactly. You might also have a cough, especially at night.
And I've heard that heart failure can cause weight gain.
You're right. It's another common symptom, rapid weight gain, especially in the legs, ankles, and belly.
Is that from the fluid buildup too?
Yep. Fluid retention.
So you might notice your pants suddenly not fitting.
Exactly. Or your rings feeling tight.
What other symptoms are there?
You might feel really tired and weak, dizzy, even nauseous.
Sounds pretty unpleasant.
They can be. And some people get palpitations.
Palpitation.
That irregular heartbeat, like your heart skipping a beat.
Okay, so there are quite a few symptoms to look out for.
And it's important to remember that the severity of the symptoms doesn't always match how weak the heart is.
What do you mean?
Someone with mild heart failure might have really noticeable symptoms, while someone else with more advanced heart failure might not feel as bad.
Oh, that's interesting. So you can't really judge by how the person feels?
Right. It can be tricky.
Can heart failure be reversed, or is it more about managing the symptoms?
The good news is it can often be managed effectively, especially if you catch it early.
Okay, that's good.
Just like with CAD, lifestyle changes are really important.
Things like diet and exercise again.
Yep, those are key. Quitting smoking, eating healthy, getting regular physical activity, managing stress, those all play a role.
It's amazing how much those things affect our health.
They're the foundation, really. But medications are usually needed too.
What kind of medications?
Doctors often prescribe diuretics, also called water pills. They help remove excess fluid from the body.
So that helps with the swelling.
Exactly. It makes it easier to breathe too. Beta blockers are another common medication. They help slow down the heart rate.
So the heart doesn't have to work as hard.
Exactly. It reduces the strain on the heart muscle. And remember ACE inhibitors?
Yeah, you mentioned those for CAD.
They're often used for heart failure too. They relax blood vessels and improve blood flow.
So again, taking some pressure off the heart.
Right. And sometimes doctors recommend implanted devices like pacemakers or defibrillators.
When would those be used?
A pacemaker helps regulate your heart rhythm if it's beating too slowly or irregularly. It's like a little computer sending signals to your heart to keep it beating at a steady pace.
Fascinating. And what about defibrillators?
Those are like a safety net for the heart. They monitor your heart rhythm and can deliver an electrical shock if your heart goes into a dangerous rhythm.
So it's like a backup system.
Exactly. They can be life-saving in certain situations.
Is a heart transplant ever an option for heart failure?
In the most severe cases, when other treatments haven't worked and the heart is very damaged, a transplant might be considered. It's a major surgery, but it can give people a second chance.
Wow, that's incredible. Medical science has come a long way.
It really has.
Let's move on to another type of heart problem. Arrhythmias. What are those exactly?
Arrhythmias are basically problems with your heart's rhythm.
Okay, so how does that happen?
It happens when the electrical signals that control your heartbeat aren't working properly.
Like faulty wiring.
You could say that. It causes your heart to beat too fast, too slow, or just erratically.
So the timing's off.
Precisely. Imagine your heart as an orchestra.
Okay, I'm listening.
The electrical signals are the conductor. If the conductor gets confused, the music's going to sound off.
That's a great analogy. So what does an arrhythmia feel like?
One of the most common symptoms is palpitations.
Palpitations again?
Yeah, it's a common symptom for a few different heart conditions. You know, that feeling like your heart skipped a beat, or it's fluttering or flip-flopping in your chest.
I think we've all felt that at some point.
You're probably right. Sometimes it's just from stress or caffeine, even certain medications. Usually nothing to worry about.
But when should we be concerned?
If you're getting them a lot, or they're really bothering you, it's worth checking with your doctor.
Just to be safe. What other symptoms might signal a problem?
Along with palpitations, arrhythmias can cause dizziness, lightheadedness, you might even faint.
Oh, wow.
Some people get short of breath, chest discomfort, or just feel weak and tired.
It sounds like it can really impact your life.
It can. And in some cases, an arrhythmia can lead to sudden cardiac arrest. That's a life-threatening emergency.
That's serious. How do they figure out what type of arrhythmia someone has and how to treat it?
They use different tests, usually an EKG, that's the most common one.
Right, the one with the spiky lines?
Exactly. Sometimes they use a Holter monitor.
What's that?
It's a portable device you wear for a day or two. It records your heart rhythm continuously.
So they can see what's happening over time.
Yep. And if the arrhythmia doesn't happen very often, they might use an event monitor.
How does that work?
You wear it for a longer period, and you activate it when you feel symptoms.
So they can catch the arrhythmia in action.
Exactly. And once they've diagnosed the type of arrhythmia, they can decide on the best treatment.
So what are the treatment options?
It depends on the cause and the type of arrhythmia. Sometimes simple lifestyle changes are enough.
Like what?
Reducing stress, cutting back on caffeine, avoiding certain medications or supplements.
So those healthy habits again.
They really do make a difference. But sometimes medication is needed.
What kind of medication?
There are medications to slow down the heart rate, regulate the heart rhythm, or prevent blood clots.
Blood clots.
Yeah, some types of arrhythmias can increase the risk of blood clots.
Oh, I didn't know that.
Yeah.
Are there any procedures used to treat arrhythmias?
Yes, a couple. One is called cardioversion. They use a controlled electrical shock to reset the heart rhythm.
So it's like rebooting the heart.
That's a good way to think about it. And for more complicated arrhythmias, they might do a catheter ablation.
What's that?
They use a catheter, a thin tube, and thread it through a blood vessel to the heart. Then they use radiofrequency energy to destroy the abnormal tissue causing the arrhythmia.
This is like a tiny surgery on the heart's electrical system.
It's pretty amazing. And it's minimally invasive, so it's much easier on the patient.
Wow, we've covered so much today. Coronary artery disease, heart attacks, heart failure, and now arrhythmias. It's a lot to take in.
It is. And there's still more to come.
That's right. We'll be back for the final part of our deep dive into heart health. We'll explore even more types of heart disease, including heart valve problems and congenital heart defects. Stay tuned. Back again for the final part of our heart health deep dive. We've already talked about a lot, from CAD and heart attacks to heart failure and arrhythmias.
We've barely scratched the surface. There's still so much to learn about this amazing organ.
You're right about that. So let's dig into something new. Heart valve problems. Can you remind us what heart valves do and what happens when they go wrong?
Sure. Think of your heart as a house with 4 rooms. Blood's always flowing in and out, right?
Okay, I'm picturing it.
Well, the heart valves are like the doors. They make sure the blood flows in the right direction at the right time. There are 4 main valves, each with its own job.
So it's all carefully controlled, like a well-choreographed dance of blood flow.
Exactly. But just like with anything, things can break down. When heart valves get damaged or diseased, it's called heart valve disease.
And that messes up the blood flow.
It can, yeah. The heart has to work harder, and it can lead to some serious problems if it's not addressed.
So what causes these valve problems in the first place?
Well, sometimes people are born with heart valve defects.
Meaning they're not formed correctly.
Right. But sometimes the problems develop later in life. Infections can cause them, or just wear and tear over time. Even some medical conditions can affect the valves.
So a lot of different things can go wrong. What happens exactly?
Well, the valves can get stiff and narrow.
So blood can't flow through easily.
Yeah, it's like a clogged pipe.
Yeah.
Or they might not close properly, and then blood leaks backward.
Like a leaky faucet. Not good. So what kind of symptoms would you see with heart valve disease?
It really varies. Some people don't notice anything for years. Others have symptoms that develop gradually.
What are some common ones?
Shortness of breath, especially when you're active, feeling tired and weak, dizziness. Some people even faint.
Oh, wow.
And some people have chest discomfort, particularly when they're exerting themselves.
So some overlap with other heart conditions, but exertion seems to be a key factor. Are there any symptoms that are less obvious? Things people might not connect to heart valve problems right away.
In severe cases, you can get those heart failure symptoms. The swelling in the legs and ankles, sudden weight gain.
From the fluid retention, right?
Exactly. And here's something interesting. Sometimes the first sign is a heart murmur.
Heart murmur.
It's this whooshing sound the doctor hears when they listen to your heart. Sometimes it's the only symptom, even if the valve problem is pretty serious.
So you might not even know anything's wrong until you go for a checkup.
That's why regular checkups are so important. It's amazing what doctors can learn just by listening to your heart.
They really can. So let's talk about treatment. Can heart valve problems be fixed?
It depends on a few things. How bad the problem is, which valve is affected. Sometimes medication is enough to manage the symptoms.
And slow down the progression of the disease.
Right, but if the valve is really damaged, you might need a procedure to repair or replace it.
So are we talking open heart surgery?
Sometimes, yes, but there are also less invasive procedures.
Yeah. Like what?
They can do some valve replacements with a catheter now. They go in through a blood vessel in your leg and thread it all the way up to your heart.
Wow, that's pretty incredible.
It is. And these procedures are always getting better, safer, and less invasive.
That's good news. Now, I know we've talked about some pretty serious heart conditions, but there's one that often starts much earlier in life. Congenital heart disease. What's different about this one?
Congenital heart disease means you're born with a heart defect.
So something happens during development.
Exactly. While the baby is in the womb, something disrupts the heart's formation.
And these defects, can they be minor?
They can be. Sometimes they're so small they never cause any problems, but others are much more serious and need to be treated right away.
It's the most common birth defect, right?
It is. It affects about 1% of all newborns.
So how do they diagnose it in babies? What should parents be looking for?
It depends on the defect. Sometimes there are no signs at birth, and they find it during a routine checkup.
You'd never even know.
But other times, the signs are more obvious. The baby's skin might have a bluish tint, their breathing could be fast, they might have trouble feeding.
So those are pretty clear signs that something's not right. What about adults who are born with heart defects? Do they always have symptoms?
Not always. Some people with minor defects might not have any symptoms until they're older. Or they might have mild symptoms that are easy to manage with medication or just lifestyle changes.
So it can be pretty mild.
It can, but other people develop more serious symptoms as they age. Shortness of breath, trouble exercising, even heart failure or valve problems.
And the treatments?
It really depends on the specific defect. Some minor ones actually close up on their own.
Really? The body just fixes itself?
It's pretty amazing, right? Some can be managed with medication, but the more complex defects usually require surgery.
And sometimes multiple surgeries.
Sometimes, yes. And in very rare cases, the defect is so severe they can't fix it completely.
Okay, and one last type of heart disease to cover. Heart muscle disease or cardiomyopathy. What can you tell us about that?
Cardiomyopathy is different because it directly affects the heart muscle itself.
So not the blood vessels or the valves.
Right. The muscle itself gets thicker, stiffer, or weaker. It can't pump blood effectively.
And what causes that?
Lots of things. It can be genetic or caused by a virus. Long-term high blood pressure can contribute to it. Too much alcohol. Even some medications or toxins.
So many different things can damage the heart muscle.
The heart's a tough organ, but it's not invincible.
So how does this affect people? What are the symptoms like?
That's the thing. It's unpredictable. Some people have no symptoms at all.
And they're fine.
They might have a normal lifespan, yeah. But for others, it gets worse over time. They get weaker, and their symptoms get more severe.
What are some of those symptoms?
Shortness of breath, fatigue, swelling in the legs and ankles. They might have a rapid or irregular heartbeat. Some people get chest pain, especially when they're active.
And in the worst cases?
It can lead to fainting, dizziness, and even heart failure.
Okay, so it can be pretty serious. What are the treatment options?
It depends, as always. But a lot of times the focus is on managing the symptoms and slowing down the progression of the disease.
So medications again?
Often, yes. Similar to those used for heart failure. Diuretics for the fluid buildup, beta blockers to slow down the heart rate, ACE inhibitors to relax the blood vessels.
Trying to help the heart function as well as it can.
Exactly. And sometimes they use pacemakers or defibrillators to help regulate the heart rhythm.
And in the most severe cases,
a heart transplant might be the only option.
Wow. We've really covered a lot today. From how heart disease is diagnosed to all these different types and their treatments. It's a lot of information.
It is, but it's important information. Understanding heart disease can really empower people to take control of their health.
Absolutely. So now that you know more about the facts, what steps can you take to prioritize your own heart health? We'd love to hear your thoughts. That's it for our deep dive into heart health. Stay curious, stay informed, and keep those hearts beating strong.